My name is Dr. Umesh Srikantha. I am a consultant neurosurgeon and head of spine services at Aster Hospitals, Bangalore. So I've done my MCH in neurosurgery from NIMANS and followed by fellowship in minimally invasive spine surgery from South Korea. So I'm going to talk on minimally invasive spine surgery because that is my area of forte. So minimally invasive spine surgery is a branch of spine surgery that is a different way of doing the surgeries through a small incision through keyhole without disrupting the muscular architecture and by preserving the important structures of the spine. So to understand the importance of minimally invasive spine surgery, we have to go back to the basics, that is the spine itself. So as we know, the spine is the main weight-bearing structure of our body, and the spine, although made up of bone and joints, is primarily stabilized by the surrounding muscles, and these muscles are very important in maintaining the stability as well as movement of the spine. So any traditional open surgery during which there is a long incision, there is some disruption of the muscular attachments to the spine, it also weakens the muscles around the spine, and that thereby resulting in the weak muscles and thereby resulting in post-operative muscle dysfunction. So minimally invasive spine surgery basically is a technique where these muscular attachments are preserved, and this entire surgery is done through small incisions by creating a track through the muscle and by sequentially dilating that track in order to reach the area of pathology, whether be it for a discectomy, whether be it for a decompression for a lumbar canal stenosis, or whether it be for single or multiple level fusions where we basically put bone chips in between the two bones and fix them with screws and rods in order to stabilize the spine. Minimally invasive spine surgery is also done or also used for many other conditions apart from the routine cases being discectomy, decompression and fusions. We at Aster do minimally invasive spine surgeries for spinal tumors, for spinal fractures and trauma, for spinal tuberculosis and other infections, and also when there is a complete loss of anterior bone, that is when there is a complete bone needs to be replaced, what procedure we call as a corpectomy. Minimally invasive spine surgery can also be used in cervical cases where there is a disc prolapse in the neck, when we need to do decompression for some canal stenosis in the neck which causes spinal cord dysfunction, and also for spinal infections and tumors that arise in the region of the neck around the spine. So whenever we say minimally invasive spine surgery, the first misconception that comes into people's mind is that it is small, or it is something inadequate, or we are not treating the pathology adequately, but nothing can be further from the truth. In minimally invasive spine surgery, only the access that we are getting to reach the area of pathology is small, but the amount of work or the amount of decompression or discectomy or tumor removal, whatever it is being done, is the same as what we were doing in a conventional or an open technique. The only thing that we are preserving here is the access structures, that is the muscles and the ligaments that are surrounding the spine, which are important for maintaining its stability and movement. So these structures are preserved, and at the same time the primary objective of the surgery, that is decompression or discectomy or achieving a fusion, this is not compromised in minimally invasive spine surgery, and that is something that we have to clearly understand, and that is a common misconception as far as minimally invasive spine surgery is concerned. But why minimally invasive spine surgery? What are the benefits? So the benefits are multifold. Now, because of preserving the muscle structures around the spine, so the strength of the spine as well as the spinal muscles is preserved. So minimally invasive spine surgery has a biomechanical advantage over a conventional and open surgery. Apart from this, there is several clinical benefits. Minimally invasive spine surgery results in less blood loss, lesser post-operative pain, and faster return to work. These are the three main advantages. Because of less blood loss, the hospital stay is less, the need of blood transfusions is less, and surgery is less morbid. Because of lesser post-operative pain, the requirement of post-operative analgesics is less, and patients can get discharged from the hospital faster. So usually on a discectomy, the patients are discharged on the same or the next day. For a decompression and fusions, they are discharged usually on the second or the third post-operative day. So apart from this, the minimally invasive spine surgery also helps in patients returning to work earlier than conventional or open surgery. Because of faster recovery, because of a better post-operative muscle function, patients can return to work as fast as possible. The spine team here at Aster is very well trained and equipped to do minimally invasive spine surgery for nearly 90% of all its patients. So majority of the cases that we treat here are through minimally invasive spine techniques, either be it a tubular retractor assisted surgeries, or it be an endoscopic spine surgery, or be it for a percutaneous spinal stabilization procedures where we have to put in screws. So even complex procedures can be treated at Aster by minimally invasive spinal techniques.